Thank you, Mr. Chairman, Secretary Azar. I want to tell you about Zoe from Seymour, Wisconsin. Zoe was born with a congenital heart defect, and she had actually open heart surgery at 5 days old. She will be able to continue to get coverage and the care that she needs thanks to the Affordable Care Act and its protections for people with pre-existing health conditions. When the Republicans were working to repeal the Affordable Care Act legislatively, I got a letter from Zoe's mom, Chelsea. And Chelsea wrote to me and she said, to me, it's like they're taking the American dream from her, referring to her daughter, Zoe. She wrote, I'm pleading with you as a mother to fight for those with pre-existing conditions. Kids in Wisconsin with pre-existing conditions are counting on you to protect that right. The administration, your administration, recently decided to support a lawsuit aimed at striking down the Affordable Care Act in its entirety and all of its protections. So how do I explain a decision like that to Zoe and her mom? Zoe, by the way, just celebrated her 6th birthday. And this is more or less a rhetorical question because I have some specifics. But how do you tell a little girl like that what's going to happen to her? And so I want to just confirm my understanding that if the Affordable Care Act is struck down in its entirety in court, a position your administration is supporting, what protections preventing insurance companies from discriminating against those with pre-existing conditions will still remain in law if it's struck down?
Yep. So, of course, there are the existing ERISA protections and HIPAA protections around pre-existing conditions that wouldn't be impacted by that for those of us who have
the marketplace
employer-sponsored insurance. And then, as I was mentioning with Ranking Member Murray, we will be working then with Congress to ensure that any new better care has protection for
pre-existing conditions. So in other words,
conditions.
If it's struck down for a time, there will be nothing in place to protect Zoe and kids like her. The truth is that there isn't a plan right now to protect Zoe or people like her with pre-existing conditions. And not only would this lawsuit take away these protections, but President Trump has broken his promise by expanding the use of junk health plans. That's what I call them because they don't have to cover pre-existing conditions. And I just want to share a couple of examples in Wisconsin. One of the plans currently available in Wisconsin from Companion Life, the very first sentence of their policy states, quote, pre-existing conditions diagnosed within the 60-month period immediately preceding such covered person's effective date are excluded for the first 12 months of coverage. Another plan sold in Wisconsin now says, quote, no benefits are payable for expenses for a pre-existing condition, described as a condition that, quote, would have caused an ordinarily prudent person to seek medical advice, diagnosis, care, or treatment within 12 months immediately preceding the date of coverage. So explain to me how this decision, not only to join this lawsuit to try to totally repeal and overturn the Affordable Care Act, but this decision to proactively expand the use and availability of these junk plans is not a broken promise to protect people with pre-existing conditions.
So I assume you're referring to the short-term limited duration plans, which we restored to use as the Obama administration had. These plans are not for everyone, and if a plan like that, and I'm quite glad that the enhanced consumer disclosures that we have are making it so apparent that if you had a pre-existing condition, those would not be plans that you should choose. You would very well want to be getting an exchange-based plan that would cover your pre-existing conditions, or a short-term duration plan that does cover pre-existing conditions.
Well, but you're arguing in court to overturn the Affordable Care Act, so there won't be a marketplace. Now I want to move on to something that you and I have discussed at length, which is drug prices. If the administration is successful in the lawsuit and the Affordable Care Act is struck down, the law's prescription drug price reforms would also be gone. Secretary Azar, your own Medicare prescription drug price proposal would be wiped out. And that's because your own pilot program is being tested through the Center for Medicare and Medicaid Innovation, CMMI, which was created under the Affordable Care Act. So yes or no, Mr. Secretary, if the lawsuit succeeds and the Affordable Care Act is struck down in court, CMMI will cease to exist, and so will this pilot. Is that true or false?
There are a great deal of ifs in there, but CMMI is part of the Affordable Care Act, and my hope would be that any better care system we set up would similarly give me authorities to do demonstrations and pilots such as the one that we are firmly committed to there of
So
international
it would
pricing
cease
index.
to exist.
We would have to find additional authority.